Nurses, I am RN Kamaljeet from Nursing Exam Prep. In this video, we will discuss the very important topic of NCLEX examination, that is heparin and warfarin. So if you are preparing for NCLEX examination or if you are planning to write the NCLEX exam, so this video is for you. So many of the nurses who are preparing for NCLEX exam, so like while you are practicing your questions for NCLEX, so it's very sure that you see this question very frequently in your preparation material. So actually, what is this? First, heparin and warfarin. What these are? So these are the anticoagulants. So means we can say that these are the anticoagulation medications. So what is anticoagulation or anticoagulants? So these prevent the formation of clots in the body. So like there is a one point that I would like to mention, that thrombolytic and anticoagulants, they both are different medications. So thrombolytics, they break the existing clots, but the anticoagulants, they prevent the formation of the clots in the body. So please don't get confused with the thrombolytics and anticoagulants. I know they both have connections with clots, but the thrombolytic, they break the clots, and anticoagulants, they prevent the formation of clots in the body. So how they prevent? Actually, they interfere with the body's coagulation process, and when it interfere with the clotting process, so means it prevent the formation of the clots in the body. So like in the body, there is a few factors those are responsible for the coagulation. So these medication, they break that chain of coagulation. So in that method, so the body cannot make the clot, because the clotting process is interrupted, right? So these medication prevent the blood clots in the persons who are at risk of coagulation. uh, the patients after surgery, they are at risk of clot formation. The patient are on long term immobility, because like when you don't do mobility, or when you don't mobilize too much, so you are at risk of coagulation or clot formation in the body. So especially the post operative patients, they are at high risk of coagulation formation. And they prevent prevention of stroke in individual with atrial fibrillation. So in atrial fibrillation disease condition, there is a risk of stroke formation. So what is stroke? Again, there is a clot formation in the brain, and so eventually it prevent the stroke in the patients with atrial fibrillations. So today we will uh, differentiate the heparin and warfarin. They both are anticoagulants, but still there is a difference between these two medications. How? First, their mode of administration. Heparin, we can give heparin IV, intravenous, and we can give subcutaneous also. And this is a rapid form of medication. Means the onset of this medication is very fast. Onset means the effectiveness, so it affect like in a short time, and but shorter duration of time. So it has a rapid onset, but it's for short period of time. So we cannot administer medication like for as a long term therapy. So on the other side, warfarin, it is only per oral route medication, so we can administer only orally. It has a slow onset, but effects are prolonged, requiring consistent daily dose. So what is warfarin? Usually these are the tablets, right? These has slow onset, means like they needs like few days, we can say that, to show their effect, but their effect is prolonged, and we can use this medication as a long term therapy. But the heparin, it's for a short term therapy, or we can say that it's only administered when patient is hospitalized. So like when patient get discharged, so then we can recommend the, or doctor will recommend the warfarin for a long term therapy, or we can say that for the lifelong therapy. So next, their generic name. Warfarin has generic name mostly if you see in the hospitals or in your study material. It's Coumadin, but heparin there is no any generic name, but it has a suffix that is parin. Like with the other antihypertensives, right? We have a suffix like lol, like for right log for beta blockers, lol family. We see that. So it has suffix that is parin means enoxaparin. So there is also one question in the NCLEX that is enoxaparin. So it's a similar like heparin, but like it's a low molecular weight heparin. How it's low molecular weight? Because it's derived from the unfractionated heparin. Uh, it cannot give IV. We can only give it subcutaneously, and it has more predictable anticoagulant response. Means it affect more fastly than heparin. And one more important thing about the enoxaparin that like and the heparin that we cannot give it in the combination, but we can give warfarin and heparin. So we can give like if the patient in the ward and you can give him a heparin also subcutaneous or IV, but you can also give the warfarin because like when the IV medication or subcutaneous medication will be at the end of its effectiveness, then warfarin will continue the effect of anticoagulation method. But we cannot give enoxaparin and heparin together. So please note this point and keep it in mind that you cannot give heparin and enoxaparin together. So, like when a patient is on the anticoagulation therapy, so I would like to mention here that these medications are like high alert medications like insulin, narcotics, and anticoagulant. So when you will work in the healthcare setting or when you will work in the hospital, you will see that you need at least two nurses to sign the anticoagulant, like to sign the heparin, so that because these medication can make the condition of the patient worse, right? Like if you will not follow the right order or according to the patient's condition. So there will be always two nurses who cross check the uh, medication prescription, dose of the medication, and time of the medication also. So, what is the nursing consideration? So, in case of heparin, nurse should focus on the monitoring of activated partial thromboplastin time, APTT time. So mostly it's 60 to 100 seconds, but this is for the patients on heparin. So this monitoring is very important due to the variation in patient response. We need to check that like is this uh, the medication that we are giving to the patient, right? So like we need to check if there is any overdose of the patient or patient's blood is getting too much thinner because of this, because if you are giving too much heparin and it can lead to bleeding inside the body. So the APTT time need to be monitored. It's really very important. And on the other hand, for warfarin, so there is no APTT time. There is a INR unit that we check. So it's normally 2.0 to 3.0 for the patients, those who are on the warfarin therapy. So these kind of monitorings are very important for the patients who are on anticoagulant therapy to prevent the risk of bleeding or to prevent the risk of internal bleeding in the patients. So then, what are reverse agent, or we can say that antidotes? So heparin, it has protamine sulfate can be used to reverse the anticoagulant effect of the heparin. So, for example, if the patient is on heparin therapy, right? So then patient start with a bleeding, or maybe patient fall, or patient has a head injury but bleeding it's too much. So then we can give the protamine sulfate to control the bleeding and to reverse the effect of the heparin. But on the other side, in case of warfarin, vitamin K is the antidote for warfarin, and we can also give fresh frozen plasma. This can be used for rapid reverse in emergency. So how fresh frozen plasma work? Actually, it has some coagulation factors. Those those help the blood to coagulate, and it can antagonist the effect of the warfarin. So next is duration of action. As I already mentioned in the previous slide, that heparin is for short term therapy, and it has the rapid action, but it has a short prolonged. Short means action, short time therapy, but warfarin it can be used as a long term therapy, and it has a long duration of action. So, what are the indications? Like, in which conditions we can give heparin, and in which conditions we can give the warfarin? So, please memorize this thing. As I told you, heparin we can use in acute settings, mean in kind of emergencies, or usually it used in the hospital stays. So, like, we can use this in the DVT thrombus, means like if then there is a clot in the veins. So we can use this to prevent the formation of clot in the patients with deep vein thrombus. Is in pulmonary embolism. So in pulmonary embolism again there is a clot formation. So we can use in those patients, and during surgery, because the patient who is on surgery or who is post-operative, he cannot mobilize too much, so there is a risk of clot formation in these patients. So with the help of heparin we can prevent the formation of clots in these patients. So on the other hand, warfarin, so as it's a kind of long-term prophylaxis, so we use this in the patients with atrial fibrillation, because the patients who are atrial fibrillation, those are at risk of clot formation, and some other cardiovascular condition, like if the patient has any prosthetic valve replacement, those patients are on long-term therapy of warfarin, because those patients are at risk of clot formations. So these were the few indications. So next is patient consultation. So as a nurse, right? So this is your responsibility to give teaching to the patient regarding the coagulation therapy, because it's a medication. So of course it will have some common effects, and as a nurse, it's your responsibility to teach the patient about these expected outcomes of the medication. So heparin we can use this during the pregnancy, but warfarin it's contraindicated in pregnancy due to its teratogenic effect, means the bad effect on the baby growth. So in heparin, the nurse will teach the patient that pain or bruising or skin irritation is common after the administration. So you can see that if you see a patient who is taking this heparin, so he has a bruise at the injection site, but it's a common. But we should teach the patient that he should report if he find any blood in stool, means like melena or any gum bleeding. So like if patient has these problems, means that we need to report to the doctor. So maybe the patient is at risk of bleeding. So for warfarin, the patient should because vitamin K is the antidote of the patient. But like if patient is taking vitamin K like in his diet, but it should be consistent. He should not stop taking of vitamin K, because this can make the effect of warfarin, right? It can affect the effectiveness of the warfarin. So like for example, if the patient is taking the regular diet containing the vitamin K, but if he stop this medication, so means like there is a no any uh, coagulation uh, uh, coagulation left in the body, so this can increase the expectation of the warfarin medication, and the patient can have the risk of bleeding. So we should teach the patient that do not stop taking the vitamin K, just eat whatever you are eating as usual. So there should not be anything new or need to stop while on the warfarin therapy, because a patient is taking warfarin for a long time, and patient is taking this at home. So the health teaching is really very important about the medications. So nurses, this was all about the heparin and warfarin, and this is really very important, and you will definitely get this question many times when you are preparing for your exams, when you are preparing for your MCQs for the NCLEX examination. So it's important to clear your concept Especially people are get confused with the INR and the APTT range. So like just memorize this, like warfarin has the INR and the heparin has APTT. These values need to be monitored. Usually the question is on this kind of questions, like which has INR value and which has the APTT. So like if the patient is on a heparin therapy, so what the nurse is expecting to check as a lab value, so it's a APTT, right? So these kind of questions you can see in the examination. So prepare well with this topic, because this is really very important topic, and I will make more videos regarding the NCLEX and nursing content in my upcoming videos. So please share this video with your friends and your family members who are preparing for NCLEX and are planning to write the NCLEX examination. And please subscribe my channel and press the bell icon to get the notification for my next videos. Thank you so much.